afternoon. I'm Meg Stanley, and I'm the Executive Director of Wholespire. I'm very excited to welcome you to Wisdom Wednesday today with Wholespire. Participating in Wisdom Wednesday webinars is an opportunity for you to learn from our leading experts on topics related to healthy eating, active living, communications, advocacy, and more. We would love to know more about each of you in the audience today, so please take a moment to introduce yourself in the chat. Before we begin, I'll mention a few housekeeping items. The webinar will be recorded and made available on the Wholespire website starting next week. Please utilize the Q&A as well as the chat features to communicate throughout the webinar, but we will also have a Q&A time period at the end of our presenter's presentation. Today's webinar is Trailblazing for Tomorrow, Cultivating Healthy Habits Through Trails and Outdoor Time. We'll be exploring how South Carolina's communities can provide fun outdoor experiences for kids and families through the Kids in Parks Track Trails Initiative. Very excited to introduce you today to Jason Uros, the Director of Kids in Parks, and also Teddy Thomas Garrick, who is in South Carolina as the Program Manager. Jason is going to start us out today, and we hope that Teddy is able to join us. They are actually on site, and Teddy is going to do her best to join in a little bit, but we are very happy and welcome Jason. Thank you for joining us today, because I'm extremely excited to learn more myself and appreciate the partnership and all of our mutual love for outdoors.
Well, very good. Thanks, Meg, and thanks, JC. Is this time for me to share my screen?
I believe so.
All right, here we go. And I guess I'll just hit the slideshow. Okay, so you might be able to see my face as like a little thing in the corner, and then the slideshow. So thank you, everybody who's out there listening to the webinar today. I'm excited to be here with Wholespire to share what Kids in Parks is doing here in South Carolina to enhance the health of kids and families and communities throughout the state through the expansion of our statewide network of trails that are designed to get kids in parks. So we have a half-hour presentation, or maybe give or take 5 minutes, and then time for questions. And Meg and JC can monitor the chat. If there's a question that's very pertinent to a slide that I'm on, feel free to jump on in and stop me. So before, as you're typing into the chat, I had another chat potential thing that you might be able to write in or for you just to reflect upon. So feel free to reflect in the chat or reflect to yourself. But I wanted you to think about any of the significant life experiences that you had as a child that may have led to your choice in your career path as a person in public health or in parks and recreation, or whatever your avenue is in the healthy eating, active living space. Like, were you a scout and you were at state parks, or did you go kayaking and canoeing with your family, or you used to build BMX jumps and ride them on your bike, or did you have like some mentor who led you on a hike or anything in the outdoors? Because the reason why I'm asking is those types of experiences lead us in particular paths in our life and help us to develop healthy eating and active living lifestyles that live on throughout our lives. And we're knowing through data that those types of activities are sort of falling off, at least in terms of people spending time in nature. And so with that, we know through research that parks and trails are underutilized. There was certainly a spike during COVID and maybe a little bit of residual since COVID. But prior to that, for several years, 20, 30 years, people were becoming less and less engaged in our parks and public lands as they were becoming more and more engaged with electronic media. Now that we have options of 300 cable TV stations, your phone, video games, internet, all the other things that can tie you to your screen, we see that kids are spending 7.5 hours per day plugged into electronic media versus only 7 minutes per day in unstructured outdoor free time. And the combination of these two things is having disturbing health impacts for our kids and families and communities. We know that, like spending time in nature, a lot of research would show that that can help to alleviate obesity, which would then help to reduce the effects of heart disease or early onset diabetes. Spending time in nature helps to reduce your stress levels and improve your self-esteem, which can help to positively impact depression or anxiety. We know that it restores your cognitive functionality and your attention restoration, which can help with schooling and things like that. And so spending time in nature is all around just a great thing to do, and it's a free activity to do. So we want our parks to look like this. The goal of Kids in Parks is to have our swing sets and our trails and our ball fields and everything else to look like this as opposed to this. Because if we don't have kids swinging on the swings today and caring about parks and walking trails and caring about birds and trees and animals, then eventually when they become the voting members of the public and they become adults, the opportunity for those swings to be vibrant because they care about them for their kids will fall away, and that infrastructure will become dilapidated. So we want our parks to be healthy. We want our public lands to be healthy with people using them. That's the crux. And so when we were thinking about how we were going to design this program all the way back in 2009, we sort of said like, well, what are we going to do? What should we do? Should we lead a guided hike? And the program actually began on the Blue Ridge Parkway. I live in Asheville, North Carolina. Teddy is my South Carolina program manager. The program's a national program. You'll learn about that in a second. But essentially, the program started as a way to get kids and families to hike along the trails along the Blue Ridge Parkway as a resource for their health. But we found that Parkway rangers, only 4 to 8% of the visitors to the Parkway attended a ranger-led program, which isn't very great. If you're trying to reach families, we want a lot of people to do the program, not just 4% or 8%. We want a much higher percentage. And so we decided to go a different route and to go with a self-guided approach. And so we designed a trailhead sign that is very colorful and has little mascots, a dog and a dragonfly named Track and Kip. And Track and Kip, attract the kids to come to this illustrated sign. And there's 4 different brochure holders that are on this sign that allow kids to go for a self-guided hike using the pamphlet to learn about lichen and flowers and birds and dragonflies and fungus and salamanders, whichever brochure topic they choose. And hopefully they're going for the hike and they're looking for these items and they're learning and they're having fun doing the activities. And ideally that creates a connection to those items, those resources. And it's a fun thing that now isn't scary. Like, I didn't know the trees and I didn't know the birds. As you start to learn the names of the trees and the birds, you start to want to go and re-experience those resources in the future. Kids can register their hikes through our website, kidsinparks.com, and we send them prizes in the mail. And the more hikes they register, the more prizes they get. The first prize they get is a little Nature Journal passport booklet and a sticker from the trail they went to. So you can see Congaree's sticker or the town of Winnsboro's sticker. And they collect those stickers in their booklet. And every time they register, they get a prize card. And so they get the poison ivy card, or they get the mushroom card, or the how to identify a bird card, and the animal tracks card. And this provides them with activities that they can take with them on any outdoor adventure. So if they don't go to a track trail, they don't go to one of our trails with the brochures, they can still have the cards with them that they can use to go out and identify various things or have activities to do when they're out on the trail. Ideally, as they register 4, 5, 6, 10 hikes at 8 different places, the importance of the prize falls away, as now I've been to 5 parks and I know the name of 10 trees and 5 birds. And I just like to do this on Saturday morning, and I want to live a happier, healthier, active lifestyle. Kids in Parks, I mentioned earlier, was a national program. There are 275 track trails in 17 states and in Washington, D.C. We're in national parks, Forest Service, Army Corps, state parks, city and county parks, schools, private lands. We have a trail and a farm in South Carolina. And we've been partnered with all different types of health organizations, Blue Cross, Blue Shield of North Carolina, and then now through this grant and what I'm going to present today, the Blue Cross Blue Shield of South Carolina Foundation and Diabetes Free SC. We partnered with DHEC. We just had a community meeting. I'm at a park in Aiken right now, and we had a community meeting with stakeholders in Aiken this morning to determine how the network of trails will be shaped in this county. So 275 trails, do they work? Do kids get outdoors? That's the question. Our registration data would suggest that it does. So over the last decade, we have had more than 40,000 registrations come in through our website of kids who are tracking their trails and registering their adventures. But we know that not everybody who hikes the trail actually goes and follows through and registers on the website. So 100 kids go hiking and 3 of them actually register. It's a 3% conversion rate, which sounds horrible. But as I always tell people, if 3% of the people that saw a Ford truck commercial bought a Ford truck, Dodge trucks wouldn't exist because everybody would own a Ford truck. You know, it's a great conversion rate. I also couldn't afford to send 1.3 million prizes to kids all over the country who registered every single adventure. So it's just a way for us to be able to take the actual data that we have and extrapolate it into its actual impacts on the ground. And so what does that look like in terms of health? Well, as I said, over the last decade or more, we've had 42,000 registrations on the website. At 3%, that's 1.3 million hikes completed by kids. If the average trail distance is 1.26 miles, and through another research study, the average completion rate is 75%, then that means 1.25 million miles have been walked by kids on track trails. Half an hour to hike a mile, 625,000 hours outdoors. Remember, the second slide was kids spend 7 minutes per day outdoors, right? So we're at 625,000 hours outdoors. And if you burn about 150 calories per mile walk, that's 190 million calories. And so now you can see why Blue Cross Blue Shield of South Carolina Foundation might be excited about funding a preventative health program that helps to engage kids in outdoor activity, time spent in nature, walking, burning calories, etc. The bottom table is including parents, right? Because the kids are coming with parents and with siblings or with friends, their grandparents, whatever it may be. And so you can see even larger health impacts associated with the total group outcomes. In terms of South Carolina, we received a pilot grant from Blue Cross Blue Shield in 2019 to test the program out. With that pilot grant, we installed 15 trails in 10 counties of South Carolina, and you can just see the just automatic ramp in popularity in the program over that time. And since then, it's continued to climb. That was with the 15 trails. There are now 30 trails in South Carolina with the new grant funding that we have. In terms of park health, that's the second half of our mission, right? We want to get kids connected to parks and public lands as a way to help them to become stewards of those places, stewards of nature, ensure that parks thrive when they become adults. So 63% of our registrants were first-time visitors to the park. 45% of registrants intentionally went to the park to hike the track trail, probably because they want to get their sticker to put into their passport booklet in order to fill up their booklet with the different stickers that they can collect. 47% of kids who register once register twice. And of those, 88% go to more than one place. Again, the importance of that sticker and wanting to collect the sticker from Congaree, and then the sticker from Winsboro, and the sticker from Sesqui, and the sticker from Table Rock, and the sticker from Pickens, right? So they're going around intentionally visiting these sites to collect their stuff. We've done several research projects, so here's a little bit about that. This is only a couple of them. There have been more research. We're currently doing a new research project with Clemson and with MUSC on the impacts of the program in South Carolina specifically, but these are a couple of other ones. So in 2014 and 15, we did a pre-post trail installation study. These were in Wilmington, North Carolina, the two trails that are circled in red. So in 2014, there were no trails. We sat at the trailhead for an entire month. We counted how many visitors walked past where the trails were going to be installed, how many were children, how many were minorities, and we counted how long, stopwatch, how long were they on the trail, the duration of their activity. In 2015, we installed the trails. We went back the same month the next year. We replicated the study and we saw increases in visitors, increases in children, 135% increase in minorities, and 8 extra minutes on the trail once they had the materials in their hand. So that was showing that when they had the activity, they were spending more time sort of interacting with the environment. Another study that we did in 2017 with the U.S. Forest Service, Rutgers, and the University of Pennsylvania. We looked at very specifically all of our data, like 17,000 rows of data. And then we looked specifically at repeat visitors, people who did more than one activity. And when we looked at that, we wanted to look for trends within those groups. And there were lots of things that were found, but two of the things that were found were that returning visitors came from areas with significantly higher rates of unemployment, highly interesting related to parks participation, because a lot of park research data would show that park users tend to come from more affluent populations. But for our program, repeat visitors were coming from these areas of rates of higher unemployment, and returning visitors came from areas with rates of persons with less than a high school diploma, which probably also kind of correlates with the result in number one. Part of that may be because many of our trails are in very rural areas. And maybe the parks that we were installing our trailhead sign, the brochures. Next thing you know, these rural parks that might not have the amenities that some of the major city parks have, all of a sudden there's this program, and when the parents or kids see the materials, they interact with them, they go onto the website, they register, they get their prize, and they're looking, oh, there's another park 20 miles away, we can go to this one, we can go to that, we can go back to the same one, right? So there was that excitement within that community that this new program was being offered within their community. So there's a link to the journal article if you would like to go and find it and read it as well. And then the last study that I'll mention is a park prescription study that we did with school nurses in Wilkesboro, North Carolina. There were 2 schools. One was a control school, no prescriptions written. The other was an intervention school, prescriptions written to every first, second, and third grade student at that school. About a week before summer vacation in 2021. We surveyed the parents before the prescriptions were written. We surveyed the parents after school came back into session in the fall. And we wanted to see what the results were in relation to the time spent outdoors and the time spent interacting with electronic media. The parents were broken into 4 groups. You either were a control or an intervention group, and then you either, during your baseline survey, had strong beliefs in the power of nature. So there were several questions that kind of gathered whether you believe that nature was important in your children's lives or less important. So these slides right here are really showing the intervention low group, so low belief group, and then the impact of how much time those kids spent outdoors versus watching screen time. So an hour and 26 minutes extra per week outdoors, and an hour and 7 minutes less of screen time within that one group. Other groups had similar, not similar, had increases in time spent outdoors and or maybe decreases, but not to the same extent as the parents who had the less belief at baseline. So this paper is also published. I didn't give a link, but I can definitely get it out to you all. So that's excellent news as well, that a prescription for outdoor activity in nature can improve the health-based outcomes and the participation in physical activity in nature for especially parents who didn't think it was that great to begin with. Amazing. Okay, South Carolina expansion, what we're all here to know about, right? So we have a grant from BlueCross BlueShield of South Carolina Foundation and Diabetes Free SC to expand this program throughout the state, every single county over the next 4 years. What is that going to look like? A little bit like this. So we've sort of looked at the DHEC regions of the state, the upstate, Midlands, Low Country, and PD. And we are going into tri-county regions. So they're kind of colored in groups of 3 or groups of 2. And so the very first counties that we did as an example were Newberry, Saluda, and Lexington. We had a community meeting in each of those counties, and we brought stakeholders in, the parks department, the hospital system, the school nurse, the mayor, the Forest Service. Everybody was there. There was 25, 30 people in the room. We're doing this in every county, and we let them prescribe where they would like the trails to be and who the healthcare providers are that should be writing prescriptions for kids to visit those trails. The county creates a community-centric plan. We then go away, we come back, we design the signs, design the brochures, install the materials, turn it all on, and then, provide the materials for the communities to do this. Newberry has their trails in the ground. Saluda has theirs. Tomorrow, we're opening 4 trails in Lexington County and Irmo Chapin. Oconee County had grand openings last weekend. Pickens County is getting 4 new trails. They might have 8 total trails by the time this is done. Anderson as well. We've done Berkeley, Dorchester, and Charleston. And as a matter of fact, the next slide shows where we've been and what we've done, and has tacks on the map that show you where those trails are going to be exactly. And so the circles and squares and the color coding might be a little bit hard, but if you study this slide, afterwards, I think they'll probably send out a PDF of the slideshow. You can see like which trails are already in, which ones were funded by the BlueCross BlueShield pilot grant, dark blue, which ones are being funded by the current BlueCross grant, the light blue, which ones are being purchased by the counties or the cities or the entities themselves. And then the color coding, the dark orange are the ones that we've had community meetings in as part of this process. The darker brown ones were from our pilot grant from 2019. I will say we had a community meeting in Barnwell yesterday. So in the Barnwell, there should be 3 dots on that map. We already know where they're going to be. And we just wrapped up the community meeting in Aiken 20 minutes ago. And so we have 5 locations to choose from where those 3 trails are going to be. Next week will be in Edgefield. So very exciting process to be able to roll these out in a systematic way and create regional, like 3, 4, 5 trails per county. Because remember, kids go once, they want to go again. If it's an hour drive to get to the next one, that might not happen. But if we can get 3 trails in a county and then 2 more that are right across the county border in the next county, they have a strong network, and that's going to allow them to go to the state park, then to the county park, and then to a national park, and then to a Forest Service site, and to another city park. And that's going to allow them to utilize that network in order to be more active more often. The prescription piece, we have money to do 100 doctor offices, pediatricians, school nurses, etc., through this grant that can write a prescription for kids to go visit these trails. We've already got materials in maybe 6 or 7 doctors' offices. It might be more in South Carolina. The numbers change all the time. But so we're rolling these materials out as the trails are rolling out. We're rolling out the doctor's office materials. And so ideally we'll have at least 100 sites prescribing outdoor activity in nature. The cool part about our prescription is the bottom right corner of that prescription pad is a serial number. When kids create their account on our website to register their hike, they enter that serial number. And when they register, the doctor office, the website knows the serial number is associated with particular doctor's offices. It will send that doctor's office a notification that one of their patients has registered. The doctor's office then has the ability to log into our website and track the use and participation of their patients, and then can implement that into their EMR as a way to be able to sort of follow up with that patient the next time the patient comes into the doctor's office to for a checkup or anything else. They can say, "Hey, I saw you did 3 hikes. Like, way to go! Let's do 3 more." Right, and use that as a way to encourage additional participation. Uh, Another part of our grant is to develop a web app. It launched on February 1st of this year. So please go check out our website, check it out on your phone. It's amazing. Kids can not only play games on the web app where they can, instead of using a paper brochure, they can scan a QR code on the trailhead sign and play all of the brochures electronically on a smartphone. Sort of a catch-22. Earlier, I said kids are plugged in. And here we are plugging them in with their smartphone. I get it. But we also need to meet them where they are. They expect to be able to potentially use these materials to find a track trail, to play games on their smartphone at that track trail, to track their adventure while they're there and answer questions about their experience, and then to earn electronic prizes. So not only do we mail them a prize, but they get badges. If they would have registered on Tuesday, they get the Earth Day badge. If they registered during the eclipse, they got the eclipse badge, right? And if they register during spring, they get the springtime badge or the summertime badge or the South Carolina State Park badge, or all the different types of badges that we create to gamify the system to encourage that participation in the program. I guess this is me, and that's Teddy. So that's our contact information. Please feel free to send us an email if you have any questions about the program or the expansion, or how or when are we coming to your county? How can we, expand the network of trails and opportunities in your county? Or, if you are a public health person and you have connections with public health people, pediatricians, doctors' offices, school nurses, etc., FQHCs who would like to write prescriptions, we're happy to make sure that we can get those materials into your hands as well. And JC and Meg, I do believe that is the end of the presentation. I will go back and I'll just find us a good slide that people can ask questions while this slide is up on the screen, and then we can go from there.
Okay, thank you so much, Jason. This I enjoyed it as much as I've heard, and we've talked, always learning something more. And really what was resonating with me, and I think with some of the folks that are probably in our audience today, is the collaborative nature of the expansion and of what you've been doing, and really including these multi-sectors and multiple interests in the community to make the decisions to where you're involved. And that really resonates with us in that decision-making process to make it a collaboration. So I really do appreciate that. I'm also very intrigued with the clinical partnership with the prescriptions. And I know right now it's really geared towards children, but I think it'll be interesting to see if that expands to multiple doctor's offices, even for adults to take their families out. So happy to be working with y'all on all of that. We are able to take questions from the audience. If anybody has them, to please place them in the chat or in the Q&A. And Claire, I see, has her hand raised, but I don't know that we have the capability to bring you on. Are you able to send your question through chat or Q&A because of the platform? And while hopefully Claire is typing her question or comment, do want to remind everybody that the slides and the recording will be available to you. It will take about a week to be able to turn those around to get to you, and then you'll be able to share the link to the webinar with your colleagues that maybe could not participate here today. And let's see, let me go to Q&A. Yes, great. Claire, I saw some of your other comments and also appreciate what you were putting into the chat, but I see that you're an assistant professor in public health and that you oversee your interns and would like to take on an internship. If so, how do I connect to this process? Jason, do y'all have any intern opportunities at this time? I know I will say that Wholespire has internship opportunities. We will be happy to provide that link to share out to your students. But right now, we don't have a project that would be specifically for this work. So, Jason, do you know if Teddy here in South Carolina has any opportunities for students coming from Lander?
So I will say yes, especially public health. There are a couple of things that if the student is interested in the prescription side, or we can modify to work within the student's needs, but off the top of my head, there's a couple of EMR, EHR sort of linkages that we're trying to navigate. How do we get the doctor to electronically prescribe the program and work in? And there's a couple of platforms that um, um, I'm dropping the name of it right now. I know what it is. I know it exists. What is it? Unite Us SC. There we go. Teddy's over here. She came. So Unite Us SC, but to like get us in and get the public health people or the pediatricians and the doctor's offices, school nurses trained on how to electronically prescribe, so that that material, that information comes to us electronically. We're able to then get the information out to the patients where we can send them, hey, these are the trails near you, you should register, etc. And then when the patient registers, being able to put that back through Unite Us, so it goes automatically back to those providers, is something that we want to build. That's just one idea. But Claire, happy to speak with you about any interest from any potential interns and what they're interested in, as a way to help serve their needs and our needs, right? It has to be a win-win for both parties.
Okay. And Claire has a follow-up with where what about students helping on the trails of the parks as volunteers in this program? Would that be going through you all or going through the site that is selected for the track trails?
That would probably go through the park that is the site that is selected for a track trail. Let's just say it was Sesqui State Park as an example. I know the rangers. I could put you in contact with them, and then the student could do some kind of internship where there was guided hikes or health programming or health education happening in conjunction with some part of the track trail or participation in the state park in general.
Okay.
So yeah.
Well, great. Well, hopefully then, Claire, your students will be able to have some resources. We also have a question regarding the sites and wondering if a nonprofit trail could qualify. And in particular, thinking about up in Greenwood County, that there's been two trails in Lake Greenwood that have just been developed, but both are managed by nonprofits.
Absolutely. So we have a private farm in Saluda County. When we went into Saluda County, there were no trails. There was one park, maybe two parks in the entire county that were very small, sort of pocket-sized parks, and no official hiking trail anywhere in the county. So we had to get a little bit creative, and we knew it was a very agricultural county. We asked the people in the community meeting if they knew of a farm that was interested in potentially having some brochures about farming and fruits and vegetables and whatnot. There was a farm that was interested. The farmer used his tractor to make a 1 mile long trail around the pastures of his farm. We designed a brochure specifically about the livestock that are in the pastures. And so it was a great opportunity to do that, but it's private property. So a nonprofit certainly would fall within that. We're doing
So
another
the
trail right
two
now with the Audubon. So yeah.
Okay. Well, then would it be best for, say, for is Jenny is actually, and the trails are actually, even though they're on Lake Greenwood, that she's referring to are actually in Lawrence County. So would that be maybe connecting with the efforts that are wherever someone is to try to get in touch with whomever maybe they're making decisions about the locations as the expansion takes place?
Absolutely, they can call us now. The next ones we're going to do in the upstate, I believe, are Greenwood, Abbeville, and McCormick. So the GAM, as it's called. So Greenville, Abbeville, McCormick. So Lawrence wouldn't be until like year 3 of our grant.
Mm-hmm.
So if the nonprofit was interested now, they could contact us and we could just do it out of order, that as a one-off. Or if they wanted to wait and be a part of the community meeting and then come in at that time and offer themselves as one of the potential sites, then we can do it then.
Okay, great. There is one more question regarding the doctor referrals. And what are the parameters for the referrals? Similar to produce prescription, where it's around food security, food insecurity reporting, is there a particular uh, guidelines in order to refer to a park, or is it up to the discretion of the physician when they prescribe?
Yeah, so I tell my doctors, all kids probably spend too much time on their phones and interacting with electronic media and not enough time outdoors. So feel free to prescribe them all. It does not have to be somebody that is within a certain BMI or other, nature serves to solve many ailments, whether that be physical, mental, emotional, cognitive, social, right? And so all kids could benefit from more time outdoors. And so feel free to pull out the prescription pad and prescribe it to all your patients as you see fit.
Well, and I know I like that, Jason, because even as a parent of now grown children, but I'm thinking in terms of the prescription pads are really sort of fun, and it's sort of that gateway of, oh, go, bug mom and dad to take me out there. And because it allows all the kids to participate and not call one child out over the other for maybe a negative, that it helps it increase as a positive prescription rather than a negative connotation.
Absolutely. Yeah.
Okay. Well, thank you so much for joining us today. I found this very useful for myself and for our organizations to continue our partnership. And we hope that everybody in the audience and those who watch this recording later are able to certainly contact Kids in Parks and also Wholespire with any more questions and thoughts on how to engage and expand this program, and just in general to get families outdoors more and away from the screen time and be a part of that positive data that's being returned. So really do appreciate it. For those of you in the audience, we do want your thoughts on today's webinar. So we'd like for you to take a moment to complete the survey that will pop up on your screen once the webinar actually ends. Your responses are very much appreciated, and we look forward to seeing you at our next webinar that is going to be on May 22nd. We'll be learning from our friends at Able SC about the importance of inclusive grant writing. And we hope that you apply for a Heal Many grant this summer. Be on the lookout for those applications to open and an RFP to be posted here soon. Thank you so much. And remember, if you have some questions or comments or want to find some more information, you can follow us on social media and also go to www.wholespire.org.